Hi, everybody. Welcome to Mastering Your Fertility TV. We are sharing with you today episode 29 of our podcast. We are interviewing board-certified pediatrician and preconception care expert, Dr. David Berger. So he has such an interesting background and story, and he currently runs a practice in Florida, I believe, called Holistic Pediatric and Family Care. And he is actually taking a very different approach to chronic conditions in his practice. So he's doing holistic biomedical treatment for autism, and he's also working with other chronic conditions like ADHD, and then immune system issues like allergies, asthma, and autoimmune conditions. So he's just such a wealth of knowledge about preconception care and about how to holistically address some of these issues that often just become chronic and even lifelong in some people, particularly neurodevelopmental disorders like ADHD and autism. So today we are talking to him about how these things can actually be prevented, or at least how we can reduce the risk of your child developing these things by proper preconception care. So preparing your body for pregnancy and taking the time to focus on things like your diet, your lifestyle, doing some testing maybe for some underlying issues. In particular, we talked to Dr. Berger about detoxification and nutritional therapies to address deficiencies that can impact the development of your child during pregnancy, and those things can also affect your fertility. And then, of course, some environmental exposures that maybe some of us aren't aware that we've had in the past, such as like heavy metals are a really good example of something that a lot of us are exposed to, particularly with like amalgam fillings. If you have silver fillings in your mouth, that can be an exposure. So he talks to us about how to address some of those things, how to test, how to treat, and then what to do in terms of diet and lifestyle modifications. And all of that comes together into this, beautiful practice that he has, where his rate of autism for children born into his practice is one in like 700 or something crazy like that. And, the national rate right now, depending on who you're talking to, is anywhere from like 1 in 36 to like 1 in 60 something. So depending on where you're getting the statistic. And so his results in his practice are pretty incredible. So we're very excited to share a little bit of his expertise and a little bit of how he works with couples and children in his practice with you today.
Yeah, so the reason we decided to interview him is because he created this new association called Preconception to Infancy, or P2I. And his big goal in life now is to actually get funding for this particular association in order to do research, because a lot of the stuff that he's doing in his private practice is something that he wants to spread to clinical practice across the nation. But a lot of it that requires big clinical trials. And so the next big step is to be able to get those clinical trials. And so we really applaud him for being able to do that, because he sees autistic children in his clinic every day coming from other practices, not his own, babies that he
that were born into his
practice, right? But that are being transferred into his practice because he's using that holistic care with autism and seeing amazing results. And so when you really see those kids up front and center, and just can see how devastating it can be and time consuming it can be on the parents and the child, and all the interventions that have to take place in order to give that child a good quality of life, has propelled him to be really active in that community and prevent autism. And that's just really amazing that he's done that. So we're going to go ahead and read his bio to you. We've kind of already explained some of this, but just to make sure that we didn't miss anything. So here in this interview, again, we're going to be talking with board-certified pediatrician and preconception care expert, Dr. David Berger. His practice is holistic pediatrics and family care, and is focused on holistic medical therapies for chronic disorders in both children and adults, including autism, ADHD, allergies, asthma, and autoimmune disorders. Dr. David also helps couples prepare for pregnancy with preconception care counseling, testing, and treatments that are aimed at optimizing the health of the pregnancy and the baby. So today he shares with us how he approaches autism and other chronic conditions that's different than conventional medicine therapies, and how we can actually reduce the risk of our children developing these conditions by intervening before we try to conceive. So Dr. David also dives into some of the specific testing, treatments, and lifestyle modifications he recommends to couples who want to do their best to prepare for pregnancy. Now you can find these links, find the links to Dr. David's website and blog on our website. So if you go to tinyfeet.co/podcast, hit up podcast number 29, you'll see his shining face on the artwork there. And you'll be able to find the link to his website if you want to read up more on what he's doing. And then Kristen's going to tell us about the Tiny Feet fertility assessment.
Yeah, so we wanted to tell you guys about the fertility assessment. This is kind of this is like the first thing that we created that actually became Tiny Feet, was this fertility assessment. And the reason that we want to talk to you about this today is because it's so relevant in terms of what we're talking about with Dr. David, which is preconception care. So this fertility assessment is an online assessment for both you and your partner. So it includes the male and female partner. We thought that was really important because obviously men should be involved in preparing for pregnancy as well. So we take you through 4 major categories of questions. So we assess for medical conditions, nutrition, lifestyle, and environmental exposure. So a lot of the things that Dr. David is intervening with in his practice, we can take you through in this assessment and give you an action plan for how to actually optimize your fertility and prepare for the healthiest possible pregnancy. And that will lead to better health outcomes for your child as they come into the world. So this assessment is $97. You can find that on our website at tinyfeet.co. Under services, you'll just click on the assessment, and that will bring you to the page where you can actually sign up and do that for you and your partner. So much information that we've included for you. We've referenced it all. It's all very evidence-based, and we give you checklists. You can actually track your progress, check off items as you do them, and you can even print your results and bring them to your doctor to help kind of integrate your care. So, everybody's on the same page and you're getting the best possible testing and treatment from your doctor that you possibly can.
And I think it's really important to know that this isn't just a preconception care plan that you can go anywhere to get for free on the website. We've included a lot of integrative therapies on there, all in one place. And it really helps with you not diagnosing, it's not going to diagnose, but it helps guide you with what might be potentially a reason why maybe you're struggling to conceive, or the next steps. So if it's been, 6 months and you still haven't conceived yet, then what are the next steps? What's going to be the most helpful thing to do to be able to propel you into the next step of being successful and having a healthy baby?
And this is really about empowerment. There's a lot of information in this assessment that we provide, but knowledge is power, and you can't fix something if you don't know it's wrong. So, lots of really great recommendations for things that you can start doing right now to make yourself healthier and create an optimal environment for that beautiful baby that you've always wanted. So we hope you enjoy the interview. Once again, you can find the assessment on our website, tinyfeet.co, and then that will be under services and the assessment.
Right. Okay, welcome, Dr. David Berger. Thank you so much for joining us on Mastering Your Fertility today. The first question that we want to ask you is just, how did you get started on this path toward working in medicine, and what motivated you specifically to become a pediatrician?
Sure. So the story supposedly goes that when I was 5 years old, I declared that I was going to be a pediatrician, and I told my pediatrician that. And that was kind of like my life plan set since like kindergarten. So with the exception of my part during my second year of college, when I told my parents after I had gotten into medical school that maybe I wanted to be a sports reporter, and I gave them a minor coronary with that one. And that lasted for about 2 weeks, but that's really been the only thing that I ever contemplated. And I was very clear, I didn't want to be a doctor. I wanted to be a pediatrician. And it was really much because of the incredible influence that my pediatrician had on me, as well as everybody in our community. Our pediatrician was the first pediatrician in the town that we grew up in. He, he's just retired a few years ago, but he was such an inspiration. His attitude, his personality was just so endearing that, you hear about most doctors, and he did wear a white coat, but even though I don't, that he you never felt scared. And how many people he helped. So he became my mentor, and I used to shadow with him back in high school, and he helped me get into medical school and all of that. So it was just really kind of from the very, very beginning. That's all I ever contemplated.
Well, that's a great story. I love that.
Yeah.
So how specifically did you get into working with children with autism, and how does your approach differ from the conventional paradigm around
Sure.
autism?
Well, we should jump forward to my pediatric residency to answer that question. One of the very first special needs kids that I had ever seen there was a child who was having infantile spasms, who had recently been started on a ketogenic diet, and the kid did remarkably well. First time I ever even contemplated that diet could change a person's health around. The kid had flown up to Johns Hopkins to get initiated. So the USF team University of South Florida team was right on board with it. So it was like, oh, okay, this is a thing, and this is something that I can contemplate in terms of dietary changes. Halfway through my residency, a wonderful journal article came out in Contemporary Pediatrics, which is the Academy of Pediatrics trade journal, called 7 Herbs Every Pediatrician Should Know About. And I asked the department chair if I could use the herbs that were listed in there. Just so happens that the founder of USF Pediatrics was one of the founders of this journal, and still sat on the executive board and the editorial board, I meant. And so they were like, that's kind of our home journal, so anything in there is fair game. And so I started using herbs in our primary care practice at the residency clinic that I was at. And so I was comfortable using natural products from that point. In addition, the gentleman I was talking about, who was the founder of our program, was also one of the very, very first advocates in America. I mean, he recently passed, Dr. Lou Barnes, wonderful, wonderful guy, but one of the very, very first advocates for breastfeeding ever in the country, really on that level. But he was also always teaching us about B vitamin metabolism. And he would come into clinic and give us another article about a kid having this reaction to that cough medicine or this reaction to that antibiotics. And then he'd start talking to me about methylmalonic acidemia. And that was kind of like his thing. And so, again, I got a very good foundation and comfort from him and support from the staff in, again, going down that line. So then when I got out of residency back in 97, I was approached by a family with a child with autism who had heard that I was open-minded and willing to try things, and asked if I could run these tests on their kid to see about candida and clostridia. And there's a basic stool and a urine test that now most of us use as our kind of baseline tests of organic acid testing and stool tests. And at the time I said to the mom, well, I don't know what I would do with the information, except for, of course, if your kid has yeast, well, I can look up at my textbook as to how to treat your kid for yeast. So that's not that big of a deal. And I guess if you're low in bacterial flora, well, you could take a probiotic. They were out and about then too. So I said, so I can't promise you that I'm going to know a lot, but I'll promise you that I'll learn a lot. And we kind of did this journey together. And then she then told some friends who told some friends. And next thing I know, I had a practice. And so that's really kind of how it grew and then right around that time, I had then also seen a child with asthma who we had done some allergy testing on, and we found several allergens. I think it was chocolate, peanuts, gluten, and dairy, if I'm not mistaken. And so we put the kid on this, and when the mom came back 3 weeks later, she said, well, not only is my kid off of all of her asthma medications, but her teeth grinding has stopped, her bedwetting has stopped, and I no longer have to give her Vitalit. And she says, so you fixed 3 things that I didn't tell you my kid was having a problem with in the first place, because I was only seeing you for a sick visit for asthma. And that was another right around that same time, and that was the other big eye-opener of, wow, when you start approaching these things and what the effects can have, not just on the symptom that you're thinking, but on the more holistic with a W concept. And so then, to take that information further into my treatment with kids with autism and then other neurodevelopmental things, started applying it to autoimmune conditions. And then at that point, that's when some moms came to me and said, hey, listen, you've really helped our kid on the spectrum out. We never thought we'd be comfortable having another kid with all of the stress and the potential of happening again. But maybe I have these issues. Can I test myself for these things and see if I have them? And my initial response was, but I'm a pediatrician. I take care of kids. And then they said, but we don't have anybody who will do this for us. And then I kind of said to myself, well, I'm certainly trained to treat somebody up to 18. There's really a difference in a woman at 18 versus a woman at 33, as an example. And of course, biologically, there's not. Okay. So then I kind of did make a call to say, well, listen, as long as you're cool with me pulling out my pediatrician card whenever I don't know something, I will never tell you a story that I don't know. If I don't know the answer, we'll do everything I can. If we have to find a specialist who will help get us further down that path, but I'll be upfront with you. I'll never try to hide my lack of knowledge to make me sound smart, because that doesn't really work out. So that was just kind of how things go. And the next thing I know, then as that was worked, then like their mom started asking me. Then I started taking care of the grandmoms, and and then I started taking care of the aunts and uncles. And so it really did grow into a family practice. And so that's why 6-ish years ago, why we formally changed the name from holistic pediatrics to holistic pediatrics and family care, to acknowledge that, yeah, we can do this. And so, yes, if a woman starts asking me about menopause, I'm going to say, I got somebody for you. That's not an area of wonderful expertise for me, or some of the geriatric only based diseases. Certainly if somebody is needing to do something for the blood pressure and it's high right away, yeah, I can do a couple of things that any physician would know about, like lisinopril, but I also want to get a cardiologist involved. Thankfully, I have a more integratively based cardiologist here who's associated with Florida Medical Clinic, so I can call upon him and he can see my patient, and he will. And I know that he's not going to first thing throw the person on a bunch of statins and a bunch of other medications. He's going to work with them to really approach that. So I just tell my patients, just when you see them for the first time, just remind him that you're a patient of mine, and he'll totally know what that means. And so that's kind of a nice way of growing. So that's kind of just the way I've grown. And while there's certainly not a ton of specialists around that are seeing the world the way I see it, I've certainly built enough of a network that like I can now call upon people in different fields and know that I'm going to get a fair shake.
Yeah. Well, I mean, we certainly appreciate that approach to medicine that you've taken, which is, you said something that really impacted me when you said that. It was like, oh man, I wish I'd had that in my past when I was sick as a child. And you said, I will take this on, and if I don't know something, I'll learn. And I think that's really important in medicine. And I think it's just missing, I think, in a lot of conventional care settings where, maybe some physicians aren't as willing to learn. And that is kind of hindering their ability to treat some of these chronic conditions that are really affecting our kids. So.
Yeah, absolutely. I mean, there's definitely a kind of a thought between physicians. If I didn't learn about it in medical school residency, it can't possibly be true. Which is even like, by the time, again, coming back to my residency, when we admitted a kid to the floor who maybe had a high fever, but through our initial testing revealed that the kid more likely had a virus and a bacteria, and we just put them in for observation and for fluids and didn't start antibiotics, we were applauded the next day on rounds for not starting antibiotics. When I got out into the real world and started my first job, and they were giving antibiotics for everything, and I would explain to the families, oh, you have a virus, you don't need an antibiotic for a virus. And then they'd be like, well, why are the other doctors telling me that? I'm like, you're going to have to ask them that question, which right. Very well received by the other doctors, and led to me being terminated after 10 months. But, and they flat out said to me, we know that what you're saying is the correct teaching, but we have our practice trained the other way, and you're just creating too much chaos, because when they come back to us, they're questioning everything that we're doing. I'm like, well, but that's what we're being taught. That wasn't even on the holistic side of things at that point. It was just like, we were just taught to be very judicious with antibiotics, and that 70% of antibiotics written for in America for children were not necessary. How can I not share that information with people? The Academy of Pediatrics says that, but it was just causing too much chaos. And thankfully, the second practice that I joined were much more open-minded, and they already had a physician there who was doing some homeopathy as a pediatrician, and they had another physician who was much more comfortable talking about these things. He kind of, whenever I would teach them about something, a couple weeks later, he'd bring that in an article substantiating although he called it Berger's 11 Herbs and Spices, kind of like a KFC kind of play off it. But hey, I'm like, at least he's willing to talk to me about it, and he's willing to have, he was a senior partner, so what he said goes, and he was totally on board with what I was doing. So it kind of just, everything kind of just happens for a reason, and things fall into place.
Yeah, definitely true.
Way to stick your ground for sure. And just, and do what you know is intuitively right and what you're trained with.
But should be about patient care, right? Not politics.
Exactly. Yeah.
Right. And again, that's why my philosophy is, I've always considered myself a pro-choice individual when it comes to a person's healthcare and their ability to decide what's best for them. A person, everybody has both the right as well as the responsibility as a parent or as an adult for themselves to weigh the potential benefit versus the potential risk compared to what the alternatives are out there. That's what the definition of informed consent is. And it doesn't necessarily mean that everybody's going to toe the party line, because we do have free will to make those decisions. There's always the interesting question of like, that the classic medical school ethical question of what do you do if a child of a Jehovah's Witness was got into a terrible car accident and is hemorrhaging, and the parent says, but we don't do transfusions. Well, and that's always a very tough question, because you're like, well, if I don't give a transfusion, this kid may not be around tomorrow to tell us what they do or don't want. Which is different than a lot of other medical decisions that are, considered a mainstream thought, but not necessarily when you're not in that life or death situation, where it's a different type of thing. And you do have more of an ability of risk versus benefit, because obviously not treating somebody who's hemorrhaging, there's obviously a high risk to that decision, potentially very fatal. So you have to kind of weigh all of those things. But I look at every case differently. I look at every person differently. I recognize that every person's going to have their own genetics, obviously, unless they have an identical twin. Every person's going to have their own nutrition that they're either being fed or that they're choosing to feed themselves. Everybody's going to have different air that they're going to breathe. And everybody's going to have different stressors on the mental health side of things. So, that's part of the reason why every single study that's been done, I have to take it with a half a grain of salt. Because unless that study was done on a bunch of clones with all of those variables that I said taken into account for that, how can you make a decision as to what's right for you, even if it was right for 80% of the other people? That means for 20% of the people, as an example, it wasn't. Right. And so for us as a establishment to then make a dictum that says, well, because it helps 80% of the people, that means 100% of the people must comply. Well, that to me is not taking that big picture into account and being able to weigh the pros and the cons.
Yeah, definitely true. So let's kind of jump into our topic today, which is kind of chronic childhood conditions and how that relates to preconception care and preparing for pregnancy. So the first question I want to ask is, are chronic childhood conditions preventable? Things like autism, asthma, allergies, eczema.
Okay. So until the properly done studies can be addressed to that one, I can only speak to my experience and the experience of my colleagues on this. So one thing I can tell you for certain, we know that the rate for autism in America right now is about 1 in 60, plus or minus 10, depending on the study you're looking at. We've had well over 1,000 babies born into our practice now. 2 have a diagnosis of autism. So something is different that we're doing now. Can I say which of the things? Because yes, the average mother in my practice nurses for 12 to 18 months, and many go longer. Can it be that again, all of my babies were, from what we're doing preconception, which we'll talk about in a bit, to the fact that I start vitamin D that first week if a baby's born by C-section, how I'm doing vaginal seeding and getting the fluoride to the baby no matter what, to the very judicious use of antibiotics. So there's so many different, to treating low vitamin D levels, to zinc levels, to whatever. There's so many variables that I do differently than what I see is happening in many a mainstream practice or conventional practice, that I don't know which of those variables is the thing that's making a difference. But certainly having a number of 1 in 500 when the national average is like almost 10 times that, it certainly does seem clear to me that we can make a difference, because that can't be just statistical noise. That's just way too different of a number. So that's, certainly part of the way that I look at that. But not only that, but I've been a pediatrician for 20 years doing this now, and I have never seen a child develop cancer. Who was born into our practice, who've developed autoimmune diseases. Very rarely do I see kids, who have chronic ear infections. I mean, the average number of ear infections in my practice is less than 1 for any given kid over their childhood. Certainly, I have parents who transfer their kids into the practice with all of those issues going on. That's a very different story, because how much was said already before I saw them. So, but even then, when we apply these same standards, these same concepts, almost always we will see their asthma getting better, their ear infections becoming less. I've had plenty of people tell me that the last time my kid had taken an antibiotic was the week before we saw you the first time, and then so again, things clearly seem to be changing there. So until the ultimate dream goal of P2I, which is to have a database with over 1 million babies in it that we can do retrospective studies, that we can go back to what was mom doing during preconception and pregnancy, antibiotic use, all the different things that kids could be exposed to during infancy and toddlerhood, and see and look at the outcomes. A retrospective study in that situation, if the data is being collected correctly, is so much more helpful than a prospective study of what's happening in the future, because then you can't look at all those different variables. And what if you're halfway into the study and you realize, oh, there was a variable that I didn't take into account? So our hope is that we will be able to develop that level of database where then we can have a bunch of adventurous grad students just mining information for data. So that's kind of where our ultimate goal is, but we're still years and funding away from being able to do that. So, but that's our ultimate goal.
Well, I think that's an amazing goal. I mean, to be able to have that data, because that's what's ultimately going to change clinical practice, right? That's what's going to change recommendations for what women should be doing preconception. Right now, we have kind of all these studies that are in various places, and there aren't very many physicians that have read all of those or kind of know how to counsel a couple during preconception on what they can be doing to potentially reduce risk of some of these conditions as they go forward. Yeah. So I guess the next question would be like, how are you seeing that the preconception health of a couple is kind of impacting the risk for some of these conditions?
Certainly. And so obviously the environment that a fetus will be developing in will certainly have an impact on that fetal development and health. Okay, so having a mom is cleaned up, having her nutrition optimized, if there is anything candida or heavy metals or other things that she's reacting to that's causing some type of cytokine or histamine reaction, to minimize it, to give the baby the optimal environment. Dad's is a little bit different. Yes, they're only providing one cell to the experience besides emotional health, but it's still an important cell. Okay, and obviously, so if a person's properly methylating and they're able to, and the DNA is properly able to unwrap itself so that I can transfer properly over to the zygote, it's still important to have all of that machinery working as well as possible. And we know how important that methylation is for, and again, with the histones and the unraveling of DNA to make it reproducible. And if a person's not methylating properly, then we know that that's an issue from cell 1 going to cell 2. To 2 cells. So that is certainly it. And then, so a lot of what I've done has really been based first and foremost on logic and reasoning. Okay. So I don't necessarily just say, hey, let's everybody take 5,000, every woman take 5,000 units of vitamin D, although who's pregnant, although that is what the Vitamin D Council recommends. But I would say, let's check your vitamin D level and see where it is. I'd love to see your level at least 50, if I can get it in the 60s range. I don't know that anybody really has an advantage of having it above 75 or 80 from what I've seen. But if I'm keeping you in that 50 to 70 range, I know I'm not hurting you, which above all do no harm. So yay. But I'm able to show people how different vitamin D levels, for instance, you need a level above 30 for bone health, but you need a level above 50 for just general immune health. And you probably need a level closer to 70 if you're dealing with mental health or immunological imbalances. But again, if the reference range is 30 to 100, and I'm telling people to aim for the glorious middle, how destructive could that possibly be? Same thing with the zinc levels. My philosophy is, since the reference ranges are based upon all people, not healthy people, then probably the unhealthier people may be leaning towards the lower end of a reference range. So my general goal, same thing with the zinc levels, for instance, is to aim for kind of more of a middle zone, and if I'm looking at a woman's thyroid levels and her free T4 level is 0.9 and normal is 0.9, and her reverse T3 and the normal level is 3.2 or above, and she's at 3.2. Maybe there, and especially if she's having symptoms of low thyroid function, although I recognize many a doctor wouldn't treat that, I would say, hey, we can bump up those levels. We can do it safely. We're going to follow up a test in 3 to 4 weeks anyways to make sure we didn't overdo it. You may feel better. And if we have you numerically as well as overall balance, then again, we know above all, do no harm. We're doing the right thing. And then we're able to approach from that. So that's kind of the way I looked at all of the nutrients and all of the stuff that we've been doing with biomedical autism, and how I then applied each and every one of those things over to the preconception and pregnancy and lactational phase.
Yeah.
That's great. I actually really appreciate that you explained kind of like the bell curve of what's normal. And if you're on the lower range, it's very likely that the assessment of that particular study of how they came up with those reference ranges isn't all healthy people. And so, of course, if you're on the lower range, it's really likely that you're really out of the optimal range, right?
And I probably want to rephrase that slightly, because I never like to get over my skis when I'm making comments. And what I would say is, that's logical. Okay.
Mm-hmm.
But B, until we know for sure, because I mean, let's face it, there are going to be some healthy people who are at the lower edge. But I would certainly say if I took 100 people who were in the lower quartile and the 100 people at the higher quartile, I most likely would see a difference. But again, until good research is done, again, recognizing what I said about research, is taken into account, we can make assumptions that we shouldn't hold as biblical, as something that's absolute sacrosanct, because I'm always open to the possibility. I mean, there's things that I know now and believe now that I didn't have the same views 10 years ago, even though at that point I was 10 years into being a holistic pediatrician. And part of what, and so, I mean, I guess, as I kind of had alluded to before, a perfect example on probiotics. Okay. Again, if a baby was born by C-section, I would automatically start them on a probiotic. Now I will talk about vaginal seeding, having the woman taking her vaginal juices and basically feeding it to the baby, in those postpartum days. One of my also general philosophies is asking myself, what does every other mammal do? And if every mammal is doing it one way and we're doing it another way, I got to seriously question who's got it right. Okay, so that was kind of like part of my argument why I'm such a strong advocate for breastfeeding. What other animal gives their baby a formula, let alone or another animal's milk, except for domesticated cats? Doesn't happen. Okay, so then I said to myself, well, does what mammal takes a probiotic? No, they don't. They eat rotting flesh. The lion finds something or a jackal's found something that's sitting there on the Sahara for a month. They're going to still eat it. Right. So we've kind of been taught to wash our hands, and thank goodness now at least they've done away with everybody must use antibiotic soaps, antibacterials. But, I kind of figured, well, no, our bodies, our intestinal tracts were never intended to be sterile. Right. I mean, we pass through a vaginal canal, hopefully, and we get exposed to bacteria before we take our first breath of life. So obviously we want to differentiate of good versus bad. But then I came to that's where I came so strongly with probiotics. But then I said, well, gee, we have so many cultured foods that are out there. So now, even like when I'm introducing baby foods, if it's 5 to 6 months of age, I'm talking to family about bringing in low sugar, preferably homemade yogurts. I'm talking to them about bringing in sauerkraut juices and or blend, or if they're making their own foods, blending in some sauerkraut cabbage itself to it. I'm talking to them about different types of pickles and pickle juices and different types of fermented foods. So that's been a transition for me that's happened in the last year or two. That's but I kind of again I always want to take a step back and not just hold because I've done it this way that means that's the right answer. And so I've really changed in that. I'm not opposed to flora for sure. I'm not opposed to probiotics because let's face it, not everybody's going to love the taste of pickles and sauerkraut, or yogurt. There's a tang to it. Part of the reason why I love introducing it at such a young age is then that it's set. Try getting a 10-year-old who's never eaten those foods to try it. At that point, that's good luck.
Harder. Yeah, much harder.
I mean, it's possible, but certainly not as easy as if day one.
So I wanted to go back to, so if a woman comes into your office, especially like you've mentioned that you work with a lot of mothers of autistic children, and they're very interested in knowing what their labs are. They're thinking about having another baby. And of course, they're going to be probably the most motivated parent when it comes to making sure that they do all the right things to prevent this from happening again, especially because their risk of it happening again is much higher. And so what kind of labs do you run for them? Or what's a basic panel that you would run for a woman that would come in?
So the thing that I believe that everybody should be checked for are vitamin D, zinc. If again, depending on what their child with autism had, so if they had an abnormal zinc to copper ratio when I checked them, then I would check that for the mom. If the child had a history of candida or clostridia, then I would check it for the mom. But I would also ask the mom, do you have a history of yeast infections? And of course, if there is, then there's more likelihood. I typically, if I'm just concerned about the fetal health, I don't necessarily do stool testing as much as I do urine testing for the organic acids, because I figure the organic acids is what's crossing into the blood, through the bloodstream into the placenta. And so that's different. But, so for instance, if someone came to be pregnant already, since I know pretty darn sure I don't want to be treating yeast if I can avoid it, both for die-off effect, herximing, or, sometimes I do find that pharmacological agents for antifungals, which, I'm very liberal on the side of those, as conservative as I am with antibiotics. But I don't want to be giving an azole antifungal to a fetus, so sometimes in life, so I'll look to see what we have, Okay. I believe in doing a full thyroid panel. For me, a full thyroid panel includes TSH, free T4, free T3, and reverse T3. I believe that if one's not looking at the reverse T3 to free T3 ratio, they've completely missed the boat. And if someone just handed me the labs of just T4 and TSH, I'd hand it back to them and say, I can't interpret this for you. Let's get more results, but I'm not going to treat you based upon these alone. Because, even if the T4 was low and the TSH was high, I don't know what's going to happen when I give that person more T4, if they're going to be converting it to reverse T3, which is going to block the thyroid receptor and cause worsening problems, even though the numbers get better. So again, that's part of what I'm looking at. Again, if, depending on where they are on the energy level, I may look at their cortisol. If they have great energy, then I'm probably not, and they're sleeping great, then I'm probably not as concerned there. If energy, when I realize that if you're a mom of a child with a special needs kid, probably fatigue is probably baked into the cake to a certain extent of that. But, looking at things like amino acid profiles and carnitine profiles, things that are pretty simple things that you can fix from an energy perspective if you find it. Okay. So I would say, and then there are also just certain things from a nutritional perspective that I would want to kind of make sure that they're covered with no matter what, such as calcium. So, I've talked to them about, well, if you have a nice robust vitamin D level, then you don't need to be taking as much calcium as if your vitamin D level is at 31. So we may, as we get through your pregnancy or you go through those changes, we may actually want to back down on their calcium as we get your vitamin D level up. Again, whoever talks about that. But those are things that, but I pretty much know, if I have a woman with a good vitamin D level, I'm only going to aim for about 80% of the RDA. I'm not going for the full 100%. I don't think a person needs to jump up to 120% of it if they got a good vitamin D level. So again, that's part of the individualized approach that we're going to take with them.
Yeah. So what about environmental concerns? Are you counseling people on toxic exposure? Are you investigating past toxic exposure?
Yeah. So it's part of that question is also obviously preconception versus in the pregnancy period very different, because especially if you're doing something that's going to cause that you're doing a test by giving such as a chelation challenge test example, where we're giving a dose of a substance that's supposed to go into the tissues, pull it out of the tissues, bring it into the bloodstream, and pee it out. Well, since we have no idea whether that would redistribute through the placenta, could we be making a situation worse? So
Right.
Some of those things, obviously, when we start talking about things like molds, those are obviously more easy to do. We can certainly start talking about cleaner diets and minimizing pesticide exposures and proper storage and avoiding BPAs, which again, thankfully, that's kind of a thing that everybody knows. Most people know at this point. But also a big part of it is even when people supplements, how pure and accurate are people's supplements? So, the reason why, why I've advocated for companies such as Kirkman Labs is simply because not very few people are doing their level of accuracy and purity testing. That, the fact that a company is checking for 950 different toxins specifically related to child development, and before the product enters into their plant, so it's not even a cross-contamination potential. That's a huge, huge thing that's not standard of care within the nutraceutical. Even within the pharmaceutical industry, they're not necessarily checking for all of those substances. They're just going to tell you the main binders that are in there. So that's obviously a big part of it as well. And of course, it does what it says on the label. If it says that there's 250 milligrams of this and 10 milligrams of that, is it accurate? So a good company should be checking every single batch to make sure that it's accuracy. So purity on the way in, accuracy on the way out gives me a much more comfort level if I know what a person's doing. Obviously, if there's a lot of sick people in the home and we're worried about a sick house at that point, then of course we're talking about, when was the last time you had your air ducts checked? Obviously, we focus a lot up on getting proper, healthy filtered water. But I get the report from the water department every year and it says it's clean. I'm like, well, great. They're also the ones selling it to you. So take that with a grain of salt. But the fact that we talked about putting whole house charcoal filters so that everything's covered, and then adding reverse osmosis to that's what's being drank, then okay, we got that covered. So all of those things we certainly take into account. Obviously, what's in the air outside your house, that's obviously a much more but having HEPA filters, UV lights within the air conditioned ducts to again make the air as purified as possible. And then a lot of what obviously if toxins being exposed is one thing, pollen being exposed. My experience is if we get all that other stuff taken care of, one's past pollen allergies may be past. and so again, you can approach it that way too.
I used to have terrible allergies and I don't have them anymore.
Yeah,
So
I was terrible. I was on allergy medicines for 30 years, and I did an elimination diet. I found it was corn that was setting me off, plus the Melaleuca trees when they were in bloom. I went over 10 years. I accidentally got exposed 3 times and went anaphylactic each time. Then I discovered my vitamin D was low, and I got my vitamin D level up to 70. And okay, I tried a piece of popcorn and I was fine. And the next day I had 2 pieces of popcorn and was fine. And I am not looking back, and I'm making up for lost time. So even though I believe in, and I do advocate for a low grain diet, it's my one grain that I do, or pseudo grain, that I allow myself to consume, just because I feel like, I beat this thing. And so I'm going to take advantage of that.
yeah.
Focusing on organic corn, so there's always ways of approaching things to the next level.
Definitely. So if you're going to see a couple or a woman for preconception care, and you identify some of these issues and you make recommendations to kind of take care of those things, how long do you recommend typically a preconception, protocol should last for kind of optimal results?
Okay. Well, what I tell people is, if I could have you 6 months before conception, that would be awesome. How many people are actually thinking 6 months ahead when things go bump in the night? That's a different story, I play the cards that I'm dealt, but I would love to have everybody 6 months. Again, part of my hope with the P2I master project that we're doing is that we're going to be able to take that data, and then we're going to be able to conform our school health classes, where we can get the girls before they're hopefully before they're having babies, and we're educating them from the beginning. Like one of the things that we talked about is like, where should we be targeting ourselves? Well, hey, maybe we should be targeting ourselves at wedding conventions, bridal conventions, types of things. Hey, that may be the first time that a woman ever thought about what she's putting into her body, because she's going to have a baby, because when she's getting married, then she, or baby fairs, those types of things. That's a nice strike while the iron's hot type of approach also. So, but if I had the ideal situation, I'd love to have 6 months to get things really optimized.
Yeah, I think that's a great time frame.
Yeah.
I mean, if people are thinking 2 years in advance, our kind of opinion is that it's never really too early to start thinking about being
healthy. And that's the whole thing. And then I would say, but this is about your health. So whether you're about to have a baby or not, you should have a good vitamin D level. If a woman has a family history of autoimmunity, approaching these things and decreasing their autoimmune potential, whether they're going to have a baby or not, it's still in their best interest. So, we when we use the term preconception to infancy, it's to drive a point home. We should be calling this the humanity project, because that's really, no matter where you are, if you're still taking a breath of life, there's potentially still a better balance that one can get if they're taking that approach.
Yeah, totally agree. I think it's just a really good, not excuse, but it's like the best timing to be able to do preconception care, because you're bringing a human into the world.
Right.
But really, preconception care is just basically like optimizing your body, right?
Yeah.
So it can last for your whole
but
life.
there's nothing that I would do for a woman who was coming in at age 30 preconception versus I want optimal wellness. I don't think there's a single thing I do differently. Now, granted, if I have a woman, for instance, who maybe has had some fertility issues in the past and miscarriages, that's when I would be saying, well, why are you having miscarriages? And so that's when we start looking to MTHFR and getting on the right form of folate, if they have it, especially if they have a double C677T. But, I start looking at the autoimmune aspect of things and the antiphospholipid syndrome, okay? And are they in a hypercoagulable state? What is their progesterone level? So if I had a woman who had a miscarriage already, I suggest the moment that we find out that you're pregnant and you have a positive urine test, let's check your quantitative beta HCGs, and so we can watch how that it's growing, that it's supposed to grow rapidly over the next few weeks to make sure that things are progressing. Let's also check a progesterone level. And if your progesterone level is under 15, I'm going to rapidly start you on progesterone, because low progesterone we know is going to lead to fetal demise. It's progesterone. It promotes gestation. That's why they call it that. Again, there's still lots of those variables, and there's that obviously I wouldn't be checking a beta HCG on somebody who wasn't pregnant, but there are those things that I can be doing ahead of time. If a person is in a hypercoagulable state, I know that I can do a blood thinner that can make it until the blood vessels leading to the placenta aren't so big and robust that we're not going to worry about it. No, but there are some families who I will keep on progesterone the whole way through. I can hurt somebody. I don't want to do something unnecessarily. So again, those are, but sort of all of those things I take into account, because if I tell a woman, if you do have another miscarriage, get a D&C. Let's see if it was a genetic issue. If it turns out that it was a trisomy 18, okay, we know that a lot of those babies aren't going to survive. Okay, then can we just chalk it up to bad luck? Probably it was. Okay, versus no, they found nothing wrong genetically, then we still have to ask the but why question. And to me, that's the really important thing. And I also believe that medicine is lacking, is asking the but why question. And every time that we get an answer, we should then ask ourselves, well, why did that happen? And so I kind of describe it like peeling back layers of an onion, but every time you peel another layer back, something else stinks. Okay, but eventually you do get to the middle of the onion. And so, but if you like, whether I'm working with a person with ADD and a family comes in and says, my kid's doing really well on Ritalin, but I don't know that I want to be doing this for the long term. Should I stop my kid's Ritalin while I'm doing what you're doing? I'm like, no, your kid's sustaining right now. I don't think an extra 3 months on Ritalin is make a difference. Can I tell you your kid's underlying problem is not a Ritalin deficiency? Yeah, there's no such thing as a Ritalin deficiency. So yes. So, but why does your kid have attention deficit disorder? Okay, it's because his vitamin D level is low. Why is it? He never spends time in the sun, versus he's genetically predisposed to not absorbing vitamin D well because his vitamin D receptor gene isn't going very well. So again, that's still another but why, that even though many a doctor now is checking for low vitamin D, they're not asking the but why question.
Yeah, really good point. Absolutely.
Well, it's so important in fertility as well as any type of chronic illness, either in children or in adults, that you're really looking at that underlying cause. And in order to do that, you do have to ask enough of those but why type of questions. And that's what's so great about the type of medicine that you're practicing. And what's so great about, naturopathic and functional medicine is that it's really about root cause, and it's really about finding and addressing whatever it is that's driving that process, whether it's infertility, chronic illness, whatever it is.
Right. Yeah. I kind of wanted to transition into pregnancy. So I know there's a couple of questions that we talked about previously before we started the recording. And I know a lot of women have questions about this. And so how do you support, just kind of in general, a woman who is pregnant? And then can you talk to us a little bit about some of the tests that they're required to do during pregnancy? So there's the glucose test that they have to do like around 26 weeks. Right. And then there's also a couple of vaccines that are recommended.
Sure. So again, I want to know what they're doing. I want to know what's being prescribed to them. Unless it's a life or death situation, I want to talk to them about it before doing something. Okay. So again, yes, thyroid testing is routinely done during pregnancy, but are they doing all four? As just an example. Okay. Now, one of the challenges that I have with the glucose tolerance test, the way it's done standardly, is I have to know, but how often is a woman actually doing that to themselves? So if a woman said to me, yeah, I drink 3 cans of Coke per day, okay, then drinking a sugary solution may be a very appropriate thing. If a woman says to me, I don't even drink juice because of the sugar content, all I drink is water, when you give somebody a non-physiological dose of sugar, something that they would never otherwise do, and then they test positive for it, does that really mean that there's any risk to that baby? No. Now, what I would tell that mom, I said, get a glucometer. So, over the next couple of weeks, just check yourself a couple times per random parts of the day and see if your blood sugar is ever running over 100. And if it's never running over 100, you don't have hyperglycemia, despite the fact that what test is your baby's not being exposed to high blood sugar, if not for that test. So again, that's again a little bit of some of those types of questions. I know some people want to do ultrasound so they can watch their baby grow. No, you do a test because it's going to make a difference in what you're in a potential outcome, right? And so obviously, if a person tested positive for Down syndrome on a blood and they want to see how things are moving along, oh yeah, an ultrasound makes perfect sense, because you need to know whether that baby has a massive cardiac problem or not, because that's even something that you could deal with while they're still pregnant, and now that they do like fetal surgeries and stuff like that. So again, we should always ask ourselves the question, why are we doing this? How is the test that we're going to do change around my recommendation? I don't believe in doing tests just for the sake of them. In terms of the question about vaccines, especially if a woman has taken flu shots before and didn't have a problem with it. And especially if a woman had taken tetanus, DTaP type or Tdaps once or older types of vaccines and didn't have a problem with it, didn't overreact immunologically.
You're talking like when they're children,
when they're younger, when they're teenagers, if they're getting tetanus shots every 10 years, or if they're one who does get a flu shot annually type of thing, or on somewhat regular basis. I know that when that woman is going to take a vaccine, the likelihood of her having an overreaction is much less than if she's never taken it before. I wouldn't know in that situation. And yes, while a vaccine does create an artificial immune response, because we know that the types of white blood cells and antibodies that are the first responders when you inject something into somebody is different than the first responders when you swallow or inhale something. But at the same time, what's passing along to the baby? And the neat thing is that, IgG antibody is really the only antibody that passes along to the baby. So while it may be an artificial immune response to the mom, whether it's IgG that gets created by the mom and gets passed along from a vaccine, or whether it's IgG from other infections that the mom has had and passed along to the baby's getting the natural IgG the same way it would be either way. So I look at it, so that's a different question when someone's asking me that question versus when when it comes to 2-month checkup and we talk about vaccines. That's a different story because, again, I have history to rely upon there. So that's kind of a nice way of looking at it as well.
But you're handling it on a case-by-case basis. You're looking at that person and saying, what is the specific situation that we're dealing with here, as opposed to this is the recommendation and this is what you're going to get.
Yeah, well, again, unless we're all part of the Clone Wars, then we're not going to be again, if you don't take it on a case-by-case basis, an individual-by-individual basis, in my opinion, we're missing a big piece of the puzzle.
Yeah. So, I have a personal experience with this during my pregnancy. First of all, previously I've had all my immunizations and I didn't have a reaction, at least that I have like an acute reaction. And so I chose to have the vaccines during pregnancy, which my hospital and doctor provided a non-preservative vaccine, which was great. So there was less like preservatives and toxins in that particular vaccine. But also, that I knew that was going to protect my baby while I was breastfeeding her for the first 4 months of her life. And so because of those IgG antibodies that were going through the breast milk and then also through the placenta. So I think it's
just technically, just about that, it's actually IgA that's going through the breast milk, not IgG for the most part.
Thank you.
Yeah, but those antibodies are still being produced, but just so we can be scientifically accurate, it's mostly IgG. So it's IgG through the placenta, IgA through the breast milk.
Yes, Dr. Berger, you're an expert on breastfeeding too, so maybe we'll have you back on the podcast to talk about that someday. That's great. So, and then I think,
but something that you said, which actually reminded me. So, also during the third trimester, and I do need to wrap things up because I have a patient that I have to start with in about 5 minutes.
Absolutely.
But these are some really important points especially during the third trimester. Is number one, I'm showing women then and there my ideal breastfeeding position that I found to be very, very helpful. I follow the Jack Newman philosophy. If anyone's not aware of Jack Newman, look him up. He's really the breastfeeding guru of Canada, and I was so fortunate to attend lectures of his about 18 years ago, and he really set me right on that. But I talked to women about hypnobirthing and the fact that you could do a self-hypnosis technique, which I witnessed twice with my own children. My wife said, ouch, literally once when Benjamin's head came through, and otherwise, whenever the midwife would say you're having a contraction, she'd have a little lip quiver, and that was the extent of what you saw in the video, except for that her left elbow was actually digging into my left thigh, and whenever she'd have contraction, she'd press down on there, and I'm like, I'm having more pain during childbirth than my wife is right now, which is kind of funny. And then I also talked to them about the perineal massaging, which is the stretching of the vaginal tissues. You're not going to run a marathon without training. And so, there are things that I'm talking about during that trimester to make it an easier, less likely for C-sections, getting the babies out faster, et cetera. So, I didn't want to miss over that because that's a really big part of what we do during pregnancy part. So
awesome. Thanks for that. And if you have like 2 minutes, I actually just wanted to ask you real quick about the B-strep test that you have to do at the end of pregnancy.
Yes. Okay. So group B strep, which is different than the strep that causes strep throats, different than the strep that's in the Prevnar vaccine, is a bacteria that is really only a problem for newborns. And it is the most common, unless identified and dealt with, cause of sepsis in the newborn. I personally, back during my residency, saw a completely healthy baby, perfect prenatal care. Both parents were in the medical field. They knew exactly what they were doing, who but didn't have a group B strep test done by their doctor, and turns out that the baby within a 12-hour period went into complete septic shock on a complete heart and lung machine. So I have seen those types of things happen. Okay, so again, everything in life needs to be asked, what's the pro versus con? Okay, so again, if a person's group B strep positive, and it ends up because it's a third C-section, it's going to be a C-section. Well, if the water doesn't break, the baby's not getting exposed to group B strep, even though they would still give that baby, recommend giving that mom antibiotics. So I'm like, how's that baby getting exposed? But if the water does break, then there is a clock ticking there. And we know that the longer that the water has been broken, the more that bacteria can ascend up into the uterus and then can expose the baby. And the longer that a baby is in the birth canal that it is. So, if somebody said to me, how would I advise my wife, which I'm comfortable answering that question, would I skip antibiotics if I had a known group B strep positive? No, I wouldn't skip the antibiotics, but I would be giving that mom tons of antibiotics or cultured foods, and I would be being even more so on making sure that the baby's getting that after the baby's born, especially if the mom had 3 or 4 doses of ampicillin. If a mom had 1 dose of ampicillin an hour before the baby was born, the baby probably didn't get exposed, and probably that mom's flora did not get knocked out. So again, case by case basis.
Yeah, that's great. So yeah, I know that they give ampicillin about every 4 hours while IV while you're in labor, and absolutely a great answer. Just knowing it's a case by case basis and work with your doctor. And I agree. I feel like you have to weigh the risk versus benefits. And in this particular situation, you may want to get the test,
Right.
just
Right.
to know.
Just to know.
Right. Well, thank you so much, Dr. Berger. We really appreciate you being on and talking to us all about preconception care and all these things that women and couples can be doing to prepare for a healthier pregnancy and have healthier babies. That's what we're all about here. So thank you so much for your time.
Absolutely. Have a great day.
All right. We hope that you enjoyed that interview. I know I really enjoyed it. He's a very entertaining but smart guy.
Very passionate. Yes.
Yes.
Definitely.
So just to wrap things up, we want to remind you that we do have the Tiny Feet Fertility Assessment on our website, $97 for you and your partner to be able to do a full medical assessment in 4 different categories, which is going to include medical, but also in nutrition, lifestyle, and environmental exposures. Get a full preconception care plan for the both of you to be able to print out, take to your doctor, know what labs you need to get done, just to have it all right there in one spot to be able to prepare for an optimal pregnancy. Also, we want to invite you to come over to Instagram and hang out with us there. We're at tinyfeet.co, and we are constantly posting new research articles and kind of really interesting information that we come across every day.
Yeah, and of course, if you enjoyed the interview and you've been enjoying our YouTube videos, please like and share. We would love to make sure that this information gets into the hands of everybody who needs it, and that really helps us out. We'll see you next week.